Hello everyone, welcome back to Surgery Clinic. Today I would like to talk about umbilical hernia, incisional hernia, ventral hernia, any abdominal hernia repair along the mid-abdomen. First, I would like to start with what to expect. Depending on the size of the hernia, which will be determined by the pre-op CT scan, usually takes 1 to 2 hours. Depending on the size, of course, small hernia takes less than 1 hour. Large hernia takes more than 2 hours. So really depends on the anatomy or the hernia defect size that you have. Recovery time, it's gonna be, if it's small, most of my patient goes home on the same day. If it's medium size to large size, patient likes to stay overnight for the better pain control. Pain and discomfort for the first 1 week, it's definitely the most, and that's expected. That's normal course after the operations. One thing I have to tell you is that the type of pain that you feel is definitely different type of pain that you had before the surgery. This is a new incisional pain, so definitely you feel the difference right after the surgery. Along the skin, you do have absorbable suture. It gets absorbed to the body as time goes on. Now, when you look at your incision, you will find white strip, it's called a steri strip, along the incision to the opposite, the vertical way. Let's say this is your incision, then you will have multiple layers of white steri strips. This is my normal routine, and this white strip usually comes off in 2 weeks. So please do not peel it off, just let it be. And I will see that in my 2 weeks follow-up appointment with you. If you see a lot of swelling along the incision, please apply ice packs. That will usually help. Anything concerning to you, call me. In terms of diet, there is no diet restriction after the hernia repair. I usually start clear liquid diet, and I gradually advance to the regular diet before the discharge. Limitation, I think this is most important after the hernia repair. Please do not lift heavier than 15 pounds for at least 6 to 8 weeks. And I'm sure your pain the first week is the most, second weeks is gonna be less. As time goes on for the 6 to 8 weeks for the full recovery, gradually your pain starts decreasing. And of course, depending on the size of the hernia, if it's a small incision, then of course your pain is much less, recovery is gonna be faster. If you have large hernia defect, then of course recovery is gonna be longer. And then also, even though you feel pain and discomfort, please walk, ambulate as much as you can. The more you get up faster from the hospital bed, that will help to prevent blood clots to your leg, and of course you can prevent pneumonia. The faster the better to get out from the bed after the operation. That's important. When to call? In the first point, the fever above 1.4, please call my office. Uncontrolled pain, no bowel movement, shortness of breath, new onset of shortness of breath, chest pressure, new onset of chest pain, lower leg swelling, persistent nausea, extreme bruising and swelling along the incision. And also, of course, if you have any further questions, please call my office to have a direct chat, and I will give you a further guidance. Medication wise, my routines, I usually prescribe narcotic medication. If it's small, then you might not even need for the Percocet. And of course, if it's a decent size, then you might need to take 1 pill. If it's large, then you might need to take 2 pills. You need to think about, we expect healing is gonna be gradual. You feel better every day. That's more important, looking at those trends for the improvement. By the time patient comes back in 2 weeks to see me, usually patient's pain is much better. I started gradually weaning off the Percocet medication, mixing with some gabapentin or muscle relaxant. Bowel care is very important, such as avoiding a severe constipation. This is gonna be the big, very, very important key point. After the surgery, or even before the surgery, just start the bowel care immediately. And this will help to avoid the constipation. Stool softeners such as Colace Doxate or the laxative, Senocot, that will help that too. When you take those medications with vegetable fibers, I cannot address and emphasize enough. Please make sure to take enough fluid. I usually recommend 7 to 8 glasses a day for the oral fluid intake. So please make sure those that as well. Surgery starts on the day of the surgery, but the preparation 1 week before the surgery, just switching all these, better diet, having a good bowel movement, good spirits, I think that really helps for the better smooth recovery. Hope this explanation, this video was helpful for you. I will keep uploading the discharge instruction further along in my career. Alright, this will conclude umbilical, ventral, incisional hernia discharge instruction. I will see you on your surgery day.